concerns about another crisis hitting the U.S. It involves depression, substance abuse, and suicide. The CDC says the suicide rate is up 35% between 1999 and 2018, meaning almost 800,000 people die of suicide each year. That's more than the entire population of Alaska. CBS 2's Sarah Jacobson has more on the sobering reality right here in our community.
Idaho has some of the highest suicide rates in the entire United States. That's according to the Idaho Department of Health and Welfare.
We've already been fighting an epidemic, mental health, in the middle now of a pandemic, coronavirus, COVID. We are 50th in the nation for mental health in Idaho, which means that we are grossly underfunded. The system is very fragmented, and it's challenging for people to have access to services. So our job was already hard.
Marissa Nickel is a licensed social worker and an adjunct professor for the School of Social Work at Boise State University. She says on top of a caseload of 90 people, she's doing all she can to help her clients through this uncertain time, and our community is hurting.
We are seeing an absolute skyrocket in incidents of depression, isolation, fear, anxiousness, hopelessness. We've seen increase in suicidal ideation, successful suicide completion. The relapse rates are insanely high, particularly here in Idaho.
Meanwhile, Idaho's unemployment insurance claims climbed above 125,000 just yesterday.
Job loss is a factor. The isolation piece is a factor. One of the things that clients weren't aware of until we went into the shelter in place was how much socialization they were receiving just by being at work, right? So that impacts people in terms of depression. You know, people are feeling alienated, isolated. Also, if you're unemployed, then you lose your health insurance benefits, which then impacts your ability to continue to seek support services, which is another tough position that we're in as providers, because as a social worker, I'm not going to drop someone just because they lose their benefits, especially in a time of crisis.
The Idaho Suicide Hotline has also seen an increase in calls pertaining to coronavirus and mental health crisis.
About 30% of our calls are focused on COVID or COVID-related issues or stressors now. The National Disaster Distress Line has seen like a 300+% increase.
A signal that Americans are hurting. But there are ways to help, even under the stay-at-home order.
That you're not alone. Want to provide hope and human connection to all of our callers, no matter what situation they're in or what kind of crisis they might be having, whether it's financial or food insecurity, emotional stuff.
While the Idaho Suicide Prevention Hotline is available 24/7, 365 days a year, they say they hope to have more volunteers once people head back to work. But that could also be another obstacle for Idahoans and our mental health services.
My concern moving forward with people going back to work is that we have to look at some type of hybrid model potentially in terms of slower reintegration that includes the components and pieces of mental health. We have to address that because everybody is feeling something about what's happening right now, whether or not they want to talk about it. So in some ways, we're normalizing mental health on a global scale and we don't even realize it because everybody has a feeling about this. So I do see that as a silver lining. What I'd like to see is more funding going towards mental health.
Sarah Jacobson, CBS 2 News.